And what's the first thing you do before you get to the ambulance when the bells go off in the station?
Before we get to the ambulance?
Yeah. What's the first thing you do as soon as the bells goes off and get out of your seat and you're gonna head towards the ambulance, but what's the first thing you do?
Well, you acknowledge the call.
Okay, you do that.
Yeah, well, yeah, I think you'd acknowledge the call and
Get
make sure you knew where it was,
Okay,
what
first
type
you
of
go to the
scene it
bathroom.
was.
Then you go back.
Well, yeah, that's
I just said that, but I
You're gonna say
was the right answer.
You guys will get used to me here in just a second.
That's so true.
Because that's absolutely true.
That is
Absolutely.
absolutely true.
Yeah, you can only hold it so long and then you embarrass yourself. Have
Okay.
you guys ever asked to use the patient's bathroom before?
No, how do
No.
you?
Oh, yeah.
But once I get into it, I forget about the
Thursday
bathroom.
night, we were on a fire standby, and I was the neighbors.
There you go. See, you never know. Okay, so you're heading
Okay.
to a nursing home, and you have a call for an unknown medical, possible unconscious, unresponsive male. Okay, so you come into the nursing home, and the staff says that he's down there at the end of the hall on the left. So I said, okay. And they said, when you're done there, come back and get his packet of paper on your way out the door.
His packet of paper?
Yeah, his packet and records and
Okay.
everything. I said, okay. So you go down there, and there's a staff member of the nursing home there, and says, hey, what's going on? He says, I don't know, I was just told to stand here until you guys got here.
Ah,
So, there you go.
So we don't have
Okay.
anybody
All you
who
know
has any
is,
information
all you know is you
on
got a
patient.
male that is unconscious maybe, or could be awake, just don't know.
He's
okay.
breathing.
Well, so I think I'd probably ask
good question.
somebody to go down to
Get
get someone
rec-
who
get somebody
is
who
familiar,
knows.
to bring the records down.
Okay.
Who could give us some history on it.
So you got your runner going.
Yeah, so they're going, so then we come in and we're just gonna, well, first we have our gloves on and
Okay.
the scene is safe
Great.
and everything. And so we just wanna see if he's conscious.
Okay.
Yeah, is he,
Start taking
Hello?
a
Hello?
blood pressure and a pulse
Hello?
ox,
is he
SO2 level.
conscious yet?
He appears not to be responding,
Okay, he's not responding.
except he's blinking his eyes at you.
Yeah, I saw the
How
blinking.
about the pain and?
Here's the stethoscope.
Ooh, he is a little
So-
blue. Not that,
So his
that he's
airway's
down and.
open, is he breathing?
Yeah, he was breathing before.
Yeah, he's breathing.
Okay, he's breathing.
What's his respiration?
Then we take his pulse, and
His-
his pulse.
Their blood
Yeah,
pressure.
his pulse
I'm not
is,
feeling any breathing.
so.
Oh, that's right.
I'm not feeling any breathing. Has the patient stopped breathing?
Well, we can at least put him on oxygen.
Oh,
No, he's
there he
breathing,
goes,
he's
okay.
breathing shallow. Pretty shallow
Okay.
breathing.
Very
Shallow.
slow, very slow.
It's slow and shallow, so, I don't know, what do you think?
We're
What's
talking maybe
It's
5 a
eight,
minute
so we need to
here.
bag
He
about,
needs to
use
be
a bag
bagged.
And he's
out.
blue, so there you
What's
go.
his pulse
Okay.
oximeter reading?
Well, let's find out.
So you're gonna bag him, and did you do the blood pressure and
Yep.
that sort of stuff, and you're doing the pulse? Okay, so then the person's arrived and we can ask him questions like,
Sure.
when was the
Reminds
last?
me
Okay,
has, like,
we need to give him a 15
Head trauma,
minutes.
if he,
Right.
blacked out, or does he have a goose egg on his
So-
head, or.
So somebody's here to answer some questions for us, so.
Yeah, here
when
comes,
was
here
he
comes the
last
packet person.
Conscious, what is his, what?
Well, we found him at shift change like this, and that was about an hour and a half ago, and we had a couple of things to do, and we finally got the paperwork filled out, so now it's time to transfer him, so.
Okay, does he have any medical?
He
Issues,
came in last week, and something about heart, and also something about diabetes or something.
Diabetes, okay, so we would check his blood sugar.
Okay, his blood sugar is 133,
It's all good.
which is
High.
Perfectly
bad.
okay.
Yeah.
At
I
this
would
point.
probably hook him on to the heart monitor,
Okay.
or the defib pad, or
So
something.
we hook him up
can't do
and,
that, though.
No, he's still,
We can do the
he's still
defib.
breathing.
I know,
Oh,
but
we
for
don't have
precautionary,
that
or,
Right.
you can look at his
Okay.
waves.
so since we've been
Monitor.
talking to him,
What's the pulse?
he's not breathing.
Okay, so we're
Yes.
bagging him.
We're
Is he still
bagging
on
him.
a
But
pulse?
yeah, as you're bagging him,
Uh-huh.
see, how
He's feel-
sophisticated this mannequin is, when he squeezes that starts to give a breath to it. He's breathing a little bit. But notice, do you know how to read the rhythm on the
No.
monitor?
No.
Okay,
I only know if it's really something obvious.
Yeah, that's obviously
I mean,
wrong.
yes, correct.
Yeah, I
So-
don't feel a pulse.
So on a
Would that-
monitor that you use and precaution, is this like an AED that you put on?
Looks like fibrillation.
It is.
Yeah.
It's ventricular fibrillation.
So if we had put the AED on, the AED would say shocking.
Correct.
Okay.
So,
Question, so
Okay.
would he have a pulse it would just be,
Not necessarily.
we wouldn't feel his pulse, he doesn't have a pulse.
Fibrillation is a,
So that's why he couldn't feel a pulse?
Right, and he's,
Okay.
it is every now and then a gasping breath, that's just those last agonal breathing, correct, like a fish out of water.
This
So
would
he
be
had
a
a
low
pulse,
go.
and then it
So
went away.
now he's in cardiac, he's in
well, no, this
cardiac.
would be a
Did
CPR.
we get
So,
a saturation before we started
it's
doing
shocking, we're gonna,
Can we do CPR on this?
You bet, absolutely, just like you normally
We're
do.
gonna-
Here's
we're
a,
gonna
here's
shock
a,
him.
a stool if you
stool.
want.
do we have a make believe AED? Or
Sure,
we do
right
have
here.
that? Okay.
Here we go.
Oh.
Do we need to get him off the bed to do effective compressions?
He'll be good.
Yes, that's true.
Let me bring it down in the world just a little bit.
Pretend we're on the floor. Pretend we're on the floor.
We do have an AED.
If he's in a nursing home, they would probably have a half board.
The patient's alter ego said your compressions are not quite adequate.
The problem is that we've got him on the bed. We need to
So,
put this patient, we need to put this patient on the floor.
Okay, but let's say we have a backward under. I think one of the problems was you were pushing right over here.
Yeah,
This
it's
is where
too
you're
far
hitting.
down on
Yeah,
the
so we just
sternum.
need, so you can just reposition your hands and keep going.
Okay, but right now, can we stand clear and?
Sure, let the AED do its
Let
thing.
the AED see
So
if
it
he's
goes
supposed
through
to
its whole
shock.
cycle and it says stand back, charging.
Okay.
It charges up and it says, what?
Shock advice.
Shock advice. So then
Okay,
we,
so-
Stand clear.
I'm clear, you're clear.
Everybody clear?
and you push the button
Uh-huh.
and
He jerks.
we wait a minute and then what do you do? Or you don't wait a minute, as soon as it goes
Well, we
off,
go
what do you
ahead
do?
As soon as you
and
go off.
Resume CPR.
Resume CPR, and then.
For how long?
2 minutes.
2 minutes.
But the AED will tell you.
5 cycles, 100 per
Will tell
second.
you, stop
per minute.
CPR.
Yeah, in 2 minutes. So in this long,
Let's just
very
say about
long,
30.
long 2 minutes,
Yes,
what do you do?
well, I think we've called,
We put oxygen
we've
in.
called
Yep, you're
for
bagging him.
ALS.
Okay,
to come
so you got
in.
ALS coming.
So ALS is on the way.
We're bagging him, we're keeping up with the CPR.
We're just gonna,
Do you guys start IVs?
we
No.
don't.
Okay, that's fine.
Yes, we did.
We will do
Okay,
that.
okay,
We don't at this point.
okay,
So
all right.
for us, what we would just be doing CPR and continue doing the shocking
And
until
shocking
ALS arrived.
Do whatever the
Okay.
AED tells us until ALS arrives.
What
We
ALS
do
is coming?
5, we do
Like, I mean,
life flight in
Well, if he's
this.
at a rest home, we don't have any rest homes up there, but so we would be in town, so I suppose it'd be in town.
Okay, okay, okay.
Yeah,
where we are, it would
So
be.
the helicopter can't fly because of weather,
Life flight?
okay,
okay, and the ambulance is gonna take a bit.
oh my.
ALS intercepted.
Because of that.
Okay, well, then we need to
Yes.
keep doing this,
Okay.
and then we're gonna have to transport him in and meet up with ALS.
Okay, so 2 minutes is up.
Okay,
So now what do we do?
so we're gonna
Is he
do
breathing?
check his, check his pulse.
So
The AED
So
will
we
tell
let the
us.
AED go through its thing,
It's gonna analyze.
and the AED says, after it's in its non-shockable rhythm.
We do check his pulse, we do CPR.
No pulse, and so you continue CPR, he is
Continue
not breathing.
CPR until
And
ALS
then we
arrives.
call for help from the rest of our people because we know we're gonna be doing CPR for an hour.
Could be, yeah.
And so we need people to rotate.
Okay, great. And how often do you rotate those people?
We've been doing it about every 10 minutes, but.
Okay.
Wow.
You guys work out.
Have you had the 2010 protocols yet?
No, we didn't.
It's hard to
That's
do
not
10
what-
minutes.
The last time we did.
You
we
change every
rotated
cycle.
About every 10 minutes. They were actually doing 10 minutes before they
Wow.
rotated. We got tough guys.
Well,
Well, but that doesn't make a difference. The AHA protocols say you have to change after every
Patient on the floor for
5
second.
cycles, every 2 minutes.
Do they currently say that? I
Yes,
haven't
that's the
been to
2010
Situation in
protocols.
the nursing
Yeah.
home, If you couldn't get the head of the bed off.
2005 didn't say that necessarily, but
Yeah.
you have to
Well,
now,
the
it's
guy that I'm
mandatory.
talking about was before 2010 too, so.
Well, everyone was supposed to recertify last year.
So that might be
No,
something.
we didn't all
Yeah,
have to.
everyone in the entire state had to recertify last year for CPR protocols.
We never got that
Okay, you
information.
need to talk to your EMS director and get it taken care of, or your medical director.
Our medical director at that time was
But there's
Dr.
definitely-
Sturkey.
Well, whoever it is, you need to get it
You know
taken care
who
of.
he is?
No, I have no idea.
Chief of MSAC.
All I know is Kim Lee, Dr. Lee, or Dr. Kim, one of the two.
I actually got that
That's no good to do
recertification,
in
but
bed like that. That's
Uh,
not effective compression.
Sure.
not all of
So
our
we either
people
need a
have.
board or have him on the.
Because they were going
And
on
what
a
you
2-year
could do
cycle.
is roll them on
Doesn't
the
make
bed,
any difference.
put your backboard in.
That was one of the mandatory things that was supposed to be done last
And we
year.
were never
Roll
told.
over.
You ever done that, Lisa?
Okay. Log rolls? Yeah.
Oh, yeah, plenty
Keep
of
the
log
bed
rolls.
sheets attached to.
Yeah.
Keep the bed sheets
Yeah.
attached?
So you got
Well,
your
I know,
patient,
like draw,
no, you got your patient like this, undo the bed sheet, pull towards you,
Yeah, just like this.
the body's laying like this now.
nice, okay.
See, watch.
Put them up on a board like
Now
that.
watch. I can do that, and I put your
Uh-huh.
backboard under, slide, now only half your backboard's there, and then we gotta lift up over here.
Then pull the backboard in the middle.
And then a spider strap or regular straps. And another thing I like to do is tape their head, or at least put towel rolls and just something to tape the head so if it isn't flopping back and forth. You can also, on the adult, you could put a towel underneath the shoulders, because then that will make your head come back a little bit and help you with that area. Yeah, good. Okay, let's stop this scenario. So what do you guys think? How do they do?